Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, when you decide to enroll into Medicare, you will enroll into what we call Original Medicare A and B. Now, beyond A and B, you will get some additional insurance. Also, almost all people do. Now, there's only two options for additional insurance beyond A and B. One of those options is to get a supplemental plan. The other one is to get an Advantage plan. Advantage plans are called replacement plans. Now, I'm not going to talk about Advantage plans today. We have plenty of instruction on MedicareSchool.com about those plans. My focus today is on Medicare supplemental plans. And the question is, which supplemental plan is the best? And so to understand supplemental plans and to make the decision for which is best for you, you have to understand that Medicare pays very well. A and B does pay well, but it does not pay all the expenses. They leave you with some financial liabilities. We call those gaps in your coverage. So Medicare pays, but you have some liability, and you may want to get a supplemental plan to cover those liabilities. And so let's review real quickly the liabilities that you have in Original Medicare. And remember, Medicare is broken up into two parts, A and B. On A, you have 3 liabilities. On B, you have 3 liabilities. So we have 3 gaps on both A and B. So let's review them real quickly. On the A of Medicare, it just means you've been put in the hospital. That's what starts Medicare A benefits. You have a deductible this year of $1,408. So you're hospitalized, it costs you out of your pocket $1,408. And this is all you actually have to pay for up to a 60-day stay in the hospital, which is going to cover probably 99% of every situation. But if you're ever in the hospital longer than that, now you have a second liability. Month 3, you have a daily copay of $352. That's $10,500 if you're in the whole month. Month 4 and month 5, they double the copay. Now it's $704 every day. And that's $21,000 month 4, $21,000 for month 5. Now, these hospital copays are rare. In other words, extended stays are not real common, but when they occur, folks, you can see they're very expensive, and you're liable for those expenses. And then the last gap on A is called skilled nursing facility. Now, skilled nursing facility is for someone that's had a stroke or maybe hip replacement, and they needed some fairly intensive rehab. Medicare says as long as you're in the hospital a minimum of 3 days, then the doctor can put you in skilled nursing, and they will cover all the expenses for the first 20 days. Doesn't cost you a penny. But if you're in skilled nursing beyond 20 days, you have now 80 more days of eligible coverage, but you're responsible for a daily copay of $176. So these are your liabilities on the A of Medicare, the inpatient side. Now let's talk about the outpatient side, which is called Medicare Part B. We start off with a deductible of $198. Now, this is a calendar year deductible. So if you start Medicare, let's say July 1, this is your deductible until 12/31. Then that number will reset every January. Last year, that read $185. It reset for this year at $198. 2 years ago, that read $183. So when it reset, it only went up $2. Went from $183 to $185. This year, $185 to $198. So every year this resets. Sometimes they never raise it. Sometimes they raise it a little bit. Historically, it's been very low. But that is the B deductible. So this means the first $198 of anything that would be outpatient related services is going to end up as a bill in your mailbox. Now that could be probably a couple doctor visits, maybe with some lab work. Let's say the first service you have for the whole year is an MRI. That first $198 is going to come out of your pocket of that MRI. Let's say you have cataract surgery for the first time for the year. That first $198 of cataract surgery expenses are going to come out of your pocket. But once a year, you meet the B deductible. And then after that, Medicare then is an 80-20 plan. Medicare pays 80%, you pay 20%. We call that coinsurance. Now, the problem with your 20% is that it is totally unlimited. So Medicare keeps paying their 80%, but you have to keep paying your 20% called coinsurance. And folks, this is actually your biggest liability today. Your biggest gap will be that 20% because it never stops. And then lastly, we have the possibility of going to a doctor that will add to the Medicare bill. We call that Medicare approved amounts. And there are some doctors that will do that. Now, the most they can add is 15%. But when they add that 15%, you're responsible to pay for it. So those are our gaps on the B of Medicare. So all of these gaps are your responsibility, your liability in original Medicare. So the majority of people will see the risk and say, not real comfortable with that amount of risk, and they want to transfer that risk away to an insurance company. And when they do that, they're buying a supplemental plan. Now, folks, there's actually 10 different plans available: A, B, C, D, F, G, K, L, M, and N. Now, I'm not going to bore you with all 10 of those. I'm going to tell you about the top 3 plans. In fact, I'd venture to say probably 90 to 95% of the Medicare population buys one of these three plans. So let's look at the differences so you can decide what's best for you. Now, if you buy an F plan, the F plan is truly a full coverage plan. It's obviously the highest cost plan as well. But the way the F plan works, as long as Medicare pays first, F follows and picks up all the expenses, fills in all the gaps. We tell our folks with F plans, if you get a bill, don't pay it, because you should never really get a bill. Medicare pays, that F's going to follow 100% of the expense. Now, there's an issue though with the F plan. Anyone that is born before January 1st, 1955 can still buy F plans. But anyone born after January 1st, 1955, you cannot purchase an F plan. Okay, all the group here was grandfathered in, and you can buy F plans if you're born before that. If not, you cannot. All right, so that takes us to our second plan. If you're born after January 1st, 55, you may want to look at a G plan. Now, a G plan is very similar to the F plan, but in one area, you'll notice we have full coverage on the hospital side, all the gaps covered. On the B side, 2 of the 3 gaps are covered. But the one gap that you're now responsible for will be that $198 deductible. So once a year, whatever the B deductible is, you're responsible to pay for that. F paid it, G does not. And that's the only difference other than the premium. And there'll be a lower premium, of course, for the G plan. I'll show you that in just a minute. So that's the only difference in coverage is the B deductible. So whenever that resets, every January, then you would have to pay the first, whatever that amount is, out of your own pocket after that full coverage. And then lastly, the N plan, very popular today. Again, same coverage on the A of Medicare. All the gaps are covered as far as hospital and skilled nursing facilities concerned. But now we have actually 2 of the 3 gaps that are not covered by the N plan. Again, we have the B deductible you're responsible for, the first $198. But notice we have an asterisk, because once we've met the $198, we're not done over here on the B side for outpatient services, because now what we have is we have a couple of copays. So you go to a doctor, go to a specialist, your primary care doctor, you're going to have a $20 copay that you would owe. So we meet our $198, and then each time we go to the doctor, we pay that $20 copay. Or if we go to the emergency room, now we have a $50 copay. Again, that's cheap, but the point is we have a couple copays added to that. And of course, our premium is going to be different. So with the G, 1 liability. With the N, we have 2 liabilities plus the possibility of copays. So those are the difference in coverages. Now let's talk about the differences in cost. Obviously, if we have an F plan, that's going to be a full coverage plan. So you're just going to simply pay full cost for those. Not really a very good value in today's market. And so that's why the majority of people are doing G plans, which we're going to save about $40 a month. So you take $40 a month times 12, we just save $480. What do we have to spend of that $480? We save $480, and all we had to do is pay our $198. So we really netted ahead on that. The savings alone in premium was enough to cover our B deductible. All right, so it's a very good value. Now when it comes to the N plan, as we compare it to the G plan, we're going to save about $20 a month, sometimes $25 a month. So we're going to save somewhere between $240 to $300 a year. And what do we take on? We took on some co-pays to the doctor, to the emergency room, and we also have to pay excess if and when that occurs. So if we have a doctor that adds 15% to the bill on the N plan, that's going to be fully out of your pocket, and there's no limit to that. And some of you will decide you're comfortable with that liability of excess charges and some co-pays, and this extra $240 to $300 a year in savings is worth it. Others of you say, no, not real comfortable with that. I think a G plan is a better value. But regardless, there is no right or wrong. There is no better than another plan. It's totally up to you, depending upon what kind of risks you're comfortable with and how much premium you want to budget for your healthcare expenses. So those are the differences between these particular 3 plans, and you have to decide what's best for you. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.